So, good morning, everybody, and to our frontline essential workers. As always, thank you for what you're doing. I appreciate everyone out there, and I appreciate everyone doing the right thing. I know the weather's breaking. Saw a lot of people out yesterday in Lincoln Park and on Hackett walking around, and doing the right stuff. So, thank you for doing that, and continue to social distance and all the good stuff, and wear a mask, and cough into your arm, and clean your hands. But sadly, we lost another Albany County resident overnight, a man in his 70s with multiple underlying health conditions, also a resident at our county nursing home, Shaker Place. And, my condolences and prayers go to the family, and to all the families that lost loved ones through these difficult times. And I keep saying this, as times have changed, we say goodbye differently now than before, and it's harder because a lot of your friends can't say goodbye and other family members can't come say goodbye. So again, my prayers are with these families through these difficult times. So we have a total of 73 now that have lost their lives to this coronavirus, and my condolences and prayers still go out to all them families, and we're here for you if you need us. Just to answer a couple questions before I start going, one of the big questions we've been getting is daycare. And I know some places like the YMCA and PAL, a few of them are still advertising. Camps are going to continue on in July and August. If we continue to go in the right direction, phase 4 starts July 1st. So that could happen and that still means you have to be in groups of less than 10, and there's a bunch of protocols they got to follow, and the guidance keeps changing. So in our control room meetings, we bring this up all the time because not only are essential employees having a hard time with daycare, non-essential workers that we hope to get back starting in phase 2 after the 3rd of June are going to have issues with daycare. So, a lot of people are going to have that same issue, especially now with summer coming up. We know a lot of families rely on summer camps. Some already have canceled. I believe like Boys Academy already canceled theirs for the summer, the first month anyway, anticipating they won't be able to open up. So it's going to be tough, and trust me when I say this to the families out there, we continue to press the issue and how we're going to address this going forward, because we need to figure it out, and we need to figure it out for everyone involved. As of today, there's 1,578 positive cases of the coronavirus. That's up 26 from yesterday. 906 people under mandatory quarantine. That's up 59 from yesterday. 5 people under precautionary. That seems the same as yesterday. There's 3,993 people have completed quarantine. And of those, 1,043 tested positive for the virus and have recovered. That's up 17 from yesterday. There are now 25 people hospitalized. That's down 2 from yesterday, with a hospitalization rate of 1.58% of those who have tested positive. Yesterday, we're at 1.73. The hospitalization rate that went down by 2. The person that we lost died at our home at Shaker Place, not in the hospital. So just to clarify that to people out there. We have 1 person currently in the ICU. It was the same as yesterday. And for the last 5-day average, we're at 25.4, slightly down from yesterday, so which is good. There's many places to go to, like we constantly say, our mobile testing sites that we still running here, Schenectady County and Rensselaer County. We have Rite Aid that's doing stuff on Central Avenue Colony, and we have Priority 1 in Guilderland, and we also have UAlbany drive-through, and we have UAlbany for essential employees that can call. So I want to remind people out there, this testing's not going away. We're going to continue to be in these communities. We're going to be continue to monitor these communities for a variety of different reasons, but you can call the number 518-465-4771, 518-465-4771, and I want to remind everyone, if you don't have health care, we're paying for it, so don't worry about it. If you don't have health care, the last thing I want you to worry about is how you're going to pay to see whether or not you have the coronavirus or you have the antibodies. We're going to make sure that that's taken care of. That should not be an issue for you to worry about if you do not have insurance. colony. As always, go to riteaid.com. You can go online to get that information, and the same thing with Priority 1 Urgent Care. You can call or go online to make an appointment. So I do want to thank our partners in that to continue to go out into the community to get this stuff done. So I thought it'd be best to go over phase 1 of reopening. We're getting a ton of questions from a lot of people. What do they need to do to comply? What are the different stuff? So we're going to talk about it a little bit. And I got a slide directly from the State New York Forward page. You got to go to New York State Forward. And I copied it too so you can get a little bit of a visual. This is like the phase 1 application that businesses have to print out. And then they keep this. This is the copy that you keep at your work. You don't submit it. You got to fill this out. So if we come in or someone comes in to see whether or not and it's at the top, there's all different places you can go to. I think this one's for, this is just a template that we talked about in the control room. I know Saratoga County had some issues yesterday. We are addressing it, Saratoga. We're there for you. That's what partners are for. But this plate right now is what we're using. The state may change it, they may add to it, but right now this is for businesses. As you can see, it's probably like 8 pages long. There's a lot of checks, and there's some comment sections you got to fill out. And it's to educate the owners of the companies as well as the people that work for the company. They can see what the plan in details and how they're making the environment safe for the workers and safe for people to come in and either pick up food or shop or whatever you may be doing. So that you can get online, and which is crucial that you need to do. The second one, the essential businesses that have been open do need to complete a reopening form and follow the guidelines even though they have already been operating. So that's why we're making this point clear. State made this clear. You have to fill out that first form we just showed you. And this one is you can go, when you go to the website, New York Forward, and you'll see the paperwork. You would select what company you are. This one's for Fish and Services. I just did this, but we have a slide up. I believe it's about manufacturing, if I stand corrected, and I can't see the screen from here without my glasses. But this form here is probably about 7 pages also. I just printed the first one so you can see what it's about. And you'll see, you'll pick where you fall under phase 1, what type of company you are. You got to read through this. Then you got to sign it, and you have to submit this. You have to submit it back to the state. This is the one that they're going to hold you accountable for. So this is the one business owners, be it you have a pizzeria, restaurant, whatever you fall in this category, jewelry store, construction. This is the one that you have to file with the state. It's easy. You got to read through it, and then you have to click on the link at the last page. You go to it, and then you submit it, and they have it on file. It not only educates you, but it protects you, and that's what you want to. So if the state comes in, they're going to know whether or not this is on their filing system. So they're going to look for they're going to look for this, that you have it, and then they're going to make sure that you already went online and did what you need to do. So these are some of the steps that you have to take. I know a lot of the companies already have, some haven't, but I'll use, I like going to Romo's for wings and pizza. But you go in there and they already have they have spots marked outside for pickup, and it's categorized 1 through 10. So you'll bring the food out to you, put it in your trunk. You never have to have contact with anyone. If you want to walk in the store to pick up your food to pay for it, they have tape on the floor keeping 6 feet away. Most restaurants are doing this. They're already doing this. It's McGarry's, same thing. You can't go in and test. It's making sure if you do, you get in 6 feet, you get your food, you get out. It's kind of neat how some people already took it upon themselves. I was at a store up in Bern last week or a week and a half ago, and the store was open, but you opened up the front door and they had plastic hanging there, a little table, so you couldn't. They had a full store, and they get your groceries or whatever you needed and hand it to you underneath the glass, and then you'd pay for it without even walking in the store. So people are thinking outside the box, and that's great, because again, it's about protecting your customers, but protecting your workers that have to work for you and have to come there to pay their bills, they pay their rent, to pay their mortgage, to keep their lights on, to not get evicted. So these are all good things to keep moving forward, and we want to do this in the right way, because I've said this yesterday and I said this before we opened up. It's going to take all of us working together to make sure that we stay opened, because in this matrix, if things change, we could take a step back, and we don't. Everyone wants to get to the second phase, and I know a lot of people definitely want to get to the fourth phase so we can reopen up. But I think Liza and I have said this time and time again. You have to still wear a mask. Yes, masks are mandatory. That's not going away, people, for a while until there's a vaccine for this or it stops spreading. So I'm not going to guess when that time frame is going to be. I'll leave that to the experts from the CDC and other areas. But we want everyone keep in mind, as workers return, the communication in all businesses is there, that the owners understand as well as the workers. So we're going to continue to make sure that we continue to educate them. That's why we did the portal, not just the state's portal, but a portal here in Albany County for the 7 counties out of the 8. So business owners can go there, look for loans, but most importantly, look for information quickly, because as they reopen, we want it done safely and effective. And I'm hoping that people are going to start keeping a log of who's coming in and out of their business to help with contract tracing if that becomes an issue. So we're asking them to do that. I know it's going to be a little difficult, but if people are going to have contact with you inside your business for whatever reason they walk in, it's important. It's important, and it helps Dr. Whalen and her team do their job effectively and efficiently if we know who's where and when. We had the issues like we had to put out there, if you went to Burger King or you went to here, please notify the Department of Health if you're on these days. If they keep a log, and I know it's a little tough, it makes our life easier if this spikes up and goes in a different direction. And at least you'll need to agree to stay up to date on state guidelines issued for your industry, and you have to agree to that. So you have to agree to continue. We can't come in there and say, well, I didn't know this. You have to, these owners or your supervisors or managers have to continue to read the guidelines coming from that respective county, from the respective health departments, and from the state health departments, or whatever new guidance the governor's office puts out. Again, we can continue to push that information out there, but you have to take a proactive approach to this to make it work for everybody. So again, I want to thank everyone for that. To outline social distancing is 6 feet, wearing face covers. As always, employees will come closer than that. Only 50% of the space can be occupied at a time, and that's why we said with restaurants, when it gets to that phase, only 50% initially when they open up. And a lot of them are already planned for it. That's why I said a lot of them are moving pool tables and video games and everything out, so they have more social distancing inside their restaurants. Some won't reopen. I know Cafe Capriccio is going to try a different model because they feel they can't do the 50% and it won't work for their type of dining place. So they're already thinking outside the box and figuring to do something else, which is good. They're not going away. You're still going to get that great food, but it's going to be a different way of getting it. So which is good. Again, they're thinking differently. Like I said, it's no more than 10 pages these companies got to go through, so please do it. And I say to the consumers, read through it too. Go to New York State Forward. Understand the guidelines. So when you're in there, you're a front line of defense. So if there's an issue, you can reach out to the health department. You can reach out to the hotline, and we can address it because we can't be everywhere. And so we're saying to you, if you know the rules, let us know if they're not following it, and we can take care of that and make sure they have a safety plan. In the control room that I'm on, we're getting answers on enforcement and hope to have that later today at 1400. We're supposed to be talking to the state police and how we're going to enforce that. That's been an ongoing question, not just for myself, but for media and everyone else. Who's enforcing these policies? Who's going to go and say someone's not doing what they need to do, especially when it comes to like campgrounds and that type of stuff. So hopefully we'll get all the answers today too, and I can share it with you tomorrow where that stands, because law enforcement wants to know as well as we do. And I know a lot of people think it's the county. We have our role. control. But other than the sheriff's department, the local police departments will be probably handling it in the city of Albany, in the villages, in the towns, in their respective areas. But again, there's more information, and this changes. And as it changes, we'll try to keep you updated. Trust me, I know some people are frustrated, but listen. They change it, we have to follow it, and if we want to do the right thing, we have to follow it, and we just need to adjust and adapt to the new situation we're in, and again, reimagine how things are going to look. Dr. Whalen.
Good morning. So yesterday, Mr. O'Connor sat in this chair and said something that struck me. He said that local businesses gearing up for phase 1 are saying that for them to open up and then to have to close again would be worse than if they never opened up again. This is understandable from a business model. We know that people have to put resources in to putting people back to work, getting supplies in, et cetera. They have to lay out these economic resources to get going again. What I want to focus on today is what we need to do as a community, as a county, to ensure that we stay on the right track, because I want to assure each and every one of you the responsibility is in your hands. When I first stood here and discussed what would be necessary for pandemic response in early March, we talked about community mitigation strategies. We've talked about them every day since then. Now they are more important than ever. In tandem with community mitigation strategies, the importance of testing cannot be understated. For us to be able to control the spread of COVID-19, we have to have the number of people tested that we can identify cases rapidly, control where their mobility so that they're not out spreading the disease, and identify their contacts and make sure that they are at home until their incubation period has passed so as not to spread it to others. So the importance of testing is really the cornerstone. And if you look at that curve we look at every day of our cases in Albany County, the epi curve, it's bell-shaped. So as we started to identify more cases, we were able to do more testing. And when we did more testing, we were able to control the movement of more people and thus limit the spread of disease. This is a cornerstone of how we avoid spread of COVID-19. So again, I encourage those of you that are going back to work in stage 1, those of you that have been identified as contacts, those of you that have symptoms, and all others that meet the criteria to get tested so that you can know, going back to your workplace, if you are currently infected with COVID-19. We know that asymptomatic spread is a real thing, and you simply can't know if you are spreading asymptomatically unless you've been tested. So I encourage that testing to take place. The second piece is the community mitigation, and this is the real responsibility of everyone. And I want to say there's not one piece of this that's foolproof, but it's the strategies all working together. So the first strategy that we talk about so much is the importance of hand hygiene and hand washing. This infection is spread through respiratory droplets and aerosols. So it is on surfaces, and it is to some extent, a lesser extent, spread through the air. So frequent hand washing allows us to prevent picking that up from a surface, then touching your hand and touching your face and become infected. That remains a very important strategy. The next thing I want to talk about is masks. And this is something that I cannot understand why there is a controversy around this. If you look at other countries that have employed masks as their strategy of community mitigation, you see that they have done better than areas that have not. There are modeling studies that are coming out on this week that show that it can decrease up to 70% of the spread. This is significant, and it is serious. We know that these surgical masks that many of you right now are wearing are worn in our operating rooms. They are there to filter droplets and are effective in respiratory droplet precaution for the person that's wearing them. Does that mean they're foolproof and protecting the wearer against COVID infection? The answer is no. We believe that they are better at source protection, which is if you have the infection, it prevents others around you from getting that infection. N95 masks that hospital workers wear are a better source of protection. So I want to put that out because I've heard from people that I know that people think if they are wearing masks, they themselves are protected. That's not the entire story. You're not completely protected wearing a surgical mask. You are offered some level of droplet protection, but you are not offered aerosol protection. There's another very important point I want to make about masks. We, at one conference, press conference here recently, talked about how to wear a mask. And I think everybody got that message. It's the colored side forward. It's not touching the mask. It's hand sanitizing first and putting the mask on. The top should be where the rigid piece is, which you push to help conform to fit your nose. When I have been driving in and out of work lately, I have seen more people wearing masks. This is a good thing. But I've also seen something that has become very widespread that I really want to encourage against. That is this. If you have your nose out of a mask, you are not protecting yourself, you're not protecting anyone else, and you are contaminating your mask. If you are wearing your mask like this to take a break, you're doing the same thing. You're contaminating what you're wearing. So masks are off or on. Off or on, no in between. If you are out walking in the general public and you are more than 6 feet away from people and you have a level of comfort that you can stay more than 6 people away, you can remove your mask and carry it by the sides. But to put it down, pull it back up, put it down, pull it back up, is not helpful. So I think that this is something that I'm seeing around a lot, and I hope that we can talk more about changing that behavior. I do think the masks are going to be essential going forward. I think that people have to get used to a comfort level of wearing them. I'm talking specifically about surgical masks today, and I understand a lot of people also are wearing homemade masks. We know that depending on the fabric of the masks, they do offer you some sort of similar droplet filtration precautions. They're better to wear than no mask at all. So continue to know the importance of this and know, again, that the masks are not the total piece of the equation, but are only effective when they are used with social distancing, staying beyond 6 feet distance, and utilizing hand sanitizing, whether it's hand washing or hand sanitizing, keeping your hands clean meticulously to protect yourself when you touch your face. All of these strategies really will make the difference. And, you know, as we've been saying all along, what you do now is going to influence what happens in 2 weeks. What do we all want to happen in 2 weeks? We want to get to the next phase. It is dependent on all of us to play our part, to do the responsible thing in order to get to that phase. So again, consider testing. If you are contacted by the health department and told you are a contact, follow our advice. We'll follow along with you daily. If you are at home, phase 1 does not mean that everything is open. It only changes things for a small number of businesses. We're still advising people to stay at home unless it's absolutely necessary to go out. We're still advising people not to get together in large groups. None of these things have changed. And it's very important that that perception in the public doesn't change just because of the words reopening being bandied about. There's a very small change with this reopening, and that's important in a phased approach. The phased approach is going to get us where we want to be. It's going to take some time, and I appreciate your patience and compliance going forward. Thank you.
Thank you, Dr. Whalen, as always. Just want to remind everyone it's day 71, and tomorrow starts 11 weeks. Like I said, it's a marathon, not a sprint. Take a step back, take a deep breath, and we'll get through this together, working together.